Hello, my name is Olatokumakine, and I'm going to be discussing the pharmacological treatment for the disease known as schizophrenia. Schizophrenia is a psychotic disorder which interferes with a person's ability to think clearly, manage emotion, relate to others, and also tell the difference between what is real and unreal. The causes of this disease are quite uncertain, and although it has been related to genetics and also brain chemistry, and it has also been related to the environment in which a person lives in, and if a person has been involved in any kind of traumatic situation since birth or actually going through one, and also it has been related to substance use that which actually plays a significant role in if a person has schizophrenia or not. A person that has schizophrenia exhibits certain behavior of hallucinations, delusions, and jumbled speech. And it's been quite a challenge for prescribers and doctors who treat patients with schizophrenia because they cannot tell what kind of treatment a person would actually be good to treat a person that exhibits such symptoms. Even with despite the pharmacological advances, it's been quite a challenge for the prescribers and the doctors to do this. In case where a person once they're diagnosed with the disease, it's a lifelong treatment, and even if the symptoms reduces, the person still has to use medication or therapy, as the case may be. Treatment of schizophrenia is usually by medications or psychosocial therapy, and in some acute cases, a person is actually hospitalized if hospitalization is needed. Medications are like a cornerstone of treating the disease, schizophrenia. And the medications, we have the first generation medication and we have the second generation medications. The medications are mostly prescribed by a doctor, and not over the counter. It has to actually be prescribed by the doctor. And these medications are thought they actually control the symptoms by affecting the brain neurotransmitter in the brain. And other medications that aside from the psychosocial medications, aside from the psychotic medications that are used to treat this disease, there are other medications like the anti-anxiety medication and the antidepressants medications. Like I said earlier, we have the first generation medication and we have the second generation medications. An example of the first generation medication, there's the chlorpromazine, there's the flufenazine, and these medications actually have certain side effects. And for the second generation medication, the examples like aripiprazole, clozapine, and ziprasidone. And where a person is like going to have a long-term treatment for this disease, it's actually recommended to go with the first generation medication. And this is because, especially with the generic ones, they are cheaper than the second generation medications. The medication, however, has certain effects on people, although they react differently depending on who is taking them in different human beings. The side effects that a person or a patient can actually show is the way they have weight gain, they have drowsiness, they might be drowsy. The medication might make them drowsy, it might make them dizzy, it might make them restless, they might have dry mouth, it might make them constipated, they might feel like throwing up, it might make them nauseous, and they might have blood vision as well. And also the medication also has been said to have the side effect of giving people blurry. The medication has also been said to cause low blood pressure and also cause seizure in patients, and has also been said to affect sexual functioning in patients. And it is very important for a patient to tell the prescriber or the doctor what other kind of medication they're using, because using these medications and any other form of medication can actually cause bad interactions with other medications. So it's very important that the patient tells the doctor what other kind of other form of medication one is using. And in addition to medication to treat this disease, psychological and social interventions are also important in treating this disease. So we have therapy to use to treat this disease. And examples of the therapy we have individual therapy, social skills training, family therapy, and we have the vocational rehabilitation and supported employment. In the case of the individual therapy, this is a one-on-one therapy between the patient and the doctor. Here, the doctor helps the patient to normalize patterns in their life. They help them to understand the situation that is real from that which is unreal. They help them to normalize what they do every day. Their everyday activities is normalized. So this helps the individual to understand, okay, when I wake up, this is what I do, this is what I'm going to do, this is the next thing to do. It's kind of like a step by step lineup of the activities of a person within a normal day. In the event of the social skills training, this helps patients to actually improve on individual ability to participate in daily activities. They teach them how to improve on what they do every day. And in the case of the family therapy, this involves the family of the patient that has schizophrenia. They help support the family and help give the family ways in helping the patient to deal with this disease. And the vocational rehabilitation and supported employment actually helps the patient, because it is very difficult for patients with this disease to be able to actually maintain some kind of normalcy and keep a job in there and have a normal day-to-day activities. So this rehabilitation actually helps them to show them how to get a job, how to retain the job, and how to actually perform in or during the job. It helps them find the resources that are necessary for them to get this job. So, as a social worker dealing with a person that has schizophrenia, my main job will be to be number one, help them to actually achieve a kind of normalcy in their life. To achieve a kind of normalcy in their life entails being able to function in a society, being able to have a job, and not just have the job, to hold the job, and to be able to interact emotionally in a normal emotional level with other people. So my job as a social worker will be to help my patients to find the necessary resources that will be able to help them to keep this normalcy in their life. Such resources including housing, jobs, support for daily living, to be able to make this person a normal and regular functioning human being in the society. Also, I should also ensure that the medications are taken when and prescribed and that as well and when prescribed and taken regularly. And I should also take note of whatever side effects this medication is having on my patient, to be able to refer them to the doctor regarding whatever symptoms or effect or side effects the medication is having on my clients. Thank you.